Hello, my name's Julian Hartley. I'm Chief Executive here at Leeds Teaching Hospitals, and we're really proud to be supporting our T-level students to come and experience work in an acute hospital setting. So let me introduce you to Leeds Teaching Hospitals. We're one of the biggest hospitals in the country. We're formed of not one, but 6 different hospitals across the city. And we focus on what we call acute hospital care, which are patients coming in for operations, accident and emergency, and also very specialist treatment and care like cancer, heart disease, children's services, major trauma. We've got a whole range of very specialist services as well as the more regular and routine hospital services. So what is it like working in a big hospital like Leeds Teaching Hospitals? Well, there are literally hundreds of different roles in a hospital. You could find yourself working in areas like physiotherapy, occupational therapy, with doctors, nurses, on wards, in clinical departments. We also, of course, have a huge estates and facilities team with our clinical support workers and also our ward housekeepers. We've got a significant number of administrative and clerical staff and receptionists and all of the roles that go together to provide the best possible experience and care for the public and the patients. So what does working in Leeds Teaching Hospitals feel like? What can you expect? Well, first and foremost, here in Leeds Teaching Hospitals, we have something very important. We call it the Leeds Way. Now, the Leeds Way is how we work, it's how we do things, it's what we expect of all of our colleagues. And the Leeds Way was created by all of our 20,000 staff. So the Leeds Way is very straightforward, but it is about 5 key things. Number 1, the Leeds Way is about being patient-centred. So while you're here, it's so important that your focus is on the patients. All of our staff have a focus on patients. It's what drives us, it's what matters most, it's how we organise things to make sure we do the very best for all of our patients. Secondly, the Leeds Way is about being collaborative. Teamwork is so important in healthcare, and particularly in a hospital where you work with a whole range of colleagues. Thirdly, the Leeds Way is about being fair. Because we serve a diverse range of communities across the city, it's very important to us we treat everyone fairly that comes into the trust. We respect equality and diversity. We want to make sure that we're fair to each other as colleagues and fair as an employer in terms of the way we have our policies and procedures that are fair to everyone. And you will be a part of that, and it's very important you feel that fairness pervades the work that you do. And then fourthly, the Leeds Way is about being accountable. It's taking responsibility. You'll get an early taste of what it's like to work in the National Health Service, which I'd say is the finest institution in this country. And finally, the Leeds Way is about being empowered. What we mean by that is we want to give you the power to make the difference. So in your job, how can you really realise your potential and achieve things perhaps you thought you would never be able to achieve by us giving you the trust, the training, the tools to really make a difference. So we're very excited about the Health T level here in Leeds Teaching Hospitals. And the programme will give you the opportunity to learn some key skills in things like anatomy, physiology, and a whole range of healthcare services to be able to pick up those insights, experience and learning, to see firsthand just what goes on and to develop your own skills, which will, I'm sure, serve you really well in a future career. So what will your placement actually look like? Well, first of all, you'll have a full induction to make sure that you're ready, you understand the organisation and you're able to make the most of it. And then we'll assign you to someone who will make sure they look out for you. They'll be your supervisor, they'll make sure that you've got that connection where you've agreed your competencies, you're thinking about how you achieve those, and then you're exposed in the workplace to a whole range of different services, and you'll be, for example, with physio, OT, pathology, pharmacy, nursing. There's a whole range of possible opportunities. So what skills and experiences will you develop as part of the placement? Well, you will be involved and learn about the day-to-day care of patients, things like feeding, wound dressings, time management, documentation, patient-centred care, liaising with relatives, all of the associated things that our teams have to deal with. And that'll give you a really good insight into all of the issues, particularly around the importance of great communication in an acute hospital. And that's one of the hallmarks of working here in Leeds Teaching Hospitals. So here at Leeds Teaching Hospitals, we're really excited about the T-level and really committed to making it work. We've always invested in our young learners, but we're really excited by the opportunity that the T-level gives you and indeed us, because it's the route and a pathway through our Future You programme, which will take non-registered learners into potentially registered full-time roles in nursing. And also it's really important for us in terms of the city of Leeds, because we have a vision across Leeds to be the best city for health and well-being, and your contribution to that, your participation in the NHS and in care services is really going to make that happen and bring that to life. And what a great thing to be a part of, to be proud to be in Leeds and contributing and working in the health and care system. So please do look forward to this. I hope that's whetted your appetite, and we're really looking forward to welcoming you to Leeds Teaching Hospitals on your T-level placement experience. Thanks very much.